The Nigerian Senate on Thursday held a marathon meeting with striking resident doctors in Abuja as part of efforts to resolve the industrial action that has crippled healthcare services across the Federal Capital Territory. The doctors, led by Dr. George Ebong, the president of the Association of Resident Doctors, FCTA, began an indefinite strike on Monday. Now they are accusing the FCT Minister Nyesom Wike of neglecting long-standing welfare and service-related issues. To report.
The session, chaired by Senator Peter Jimmy Kuta of Taraba South, saw lawmakers commend the doctors' patriotism for staying committed to service despite the ongoing exodus of medical professionals. Senators acknowledged the poor working conditions and pledged to push for urgent remedies. Committee members appealed for a short-term solution and urged the doctors to suspend the strike while the Senate engages the FCT administration.
Listed your issues, but in your presentation, I would have loved to hear some short-term demands. There are longer-term demands that cannot be fixed immediately. Equipment to be imported, shortage of equipment, policies to stop Japa syndrome need to be put in place, etc.
Senator Jimmy Kuta assured the delegation that he would personally meet with Minister Wike before the end of the day to seek immediate relief measures.
And let me tell you something. Let me just highlight one or two things. You see, when you meet somebody that is in action, everybody will want everything to happen at the same time. I'm not working to be for the minister. But as far as I'm concerned, it's different for us. I said the minister is the symbol of the renewal of Mr. President. Because there's evidence of performing in some other areas.
Responding, Dr. Ebong condemned what he described as the risky and unprofessional conditions under which resident doctors operate. Supporting him, Dr. Osundara Tokbe-Zenith, the president of the Nigerian Association of Resident Doctors, warned that attempts to enforce a no-work, no-pay policy or dismiss striking doctors could trigger a nationwide medical emergency.
We have an issue with manpower. And I'll give an example of one of the hospitals. Let me use one of our FCTA hospitals for example, the Nigerian General Hospital. Nigerian General Hospital has about 20 doctors, and they see about 20,000 patients in a month, and they have just 40 beds.
So, what happened in some years back, we can have this here. So, it is going to be a national disaster that even doctor in this FCTA is sacked, just because they are agitating for their right. We are going to declare a state of emergency from the National Office of Man.
After a closed-door session, Senator Jimmy Kuta told journalists that the talks were robust, expressing optimism that the doctors would brief their members and return with a positive update on suspending the strike.